POTS syndrome. You ever heard of that? It's called postural orthostatic tachycardia syndrome. That's a mouthful. But basically what it means is this, and a lot of people may or may not know that they suffer from this, but basically what's happening in the body is we have a dysregulation of the autonomic nervous system. So for when people first arise from a seated, or rather a lying position, what should happen is our heart rate should pick up and we get enough blood pressure to increase to force blood up into our cranial vault so that we don't become dizzy. But people that suffer from POTS syndrome, that doesn't happen. The tachycardia is where the heart rate picks up fast to try to get the blood pressure up so that we can have blood and oxygen to our brain, but that doesn't happen. So when we have POTS syndrome, what happens is we arise and we feel dizzy, lightheaded, sometimes we can feel nauseous. That's going to affect those type of things in the body that you may recognize. What most people don't recognize or may not even know is that POTS syndrome can be caused by a traumatic brain injury. So if you've ever had a concussion, which seems to be more popular now than ever, a lot of kids are getting those with this football and things like that. Even a car accident, you may have hit your head, you may not have thought anything of it, but it can have an effect specifically on this upper cervical region. And this area right here is where we have the brainstem, and inside the brainstem lies things like the cardiac center and the respiratory center. So those have an influence on those areas, which has a lot to do with the autonomic nervous system. So if you're having trouble, don't know what that is, would like to be checked and see if we can be of benefit to you, give us a call here at Desoto Upper Cervical, 662-393-4848.